Welcome to Virtual Face-to-Face with Dr. Bruce Jarrell. I'm Jenna Frick, Senior Media Relations Specialist for the University of Maryland, Baltimore, and filling in for Alex Lukowski as today's moderator. This month, you all may have noticed a new face in the University of Maryland School of Social Work. On July 1st, the school officially welcomed Dr. Judy Postmus as the new Dean of Social Work. Dr. Postmus comes to UMB from Rutgers University, where she was a professor and the Associate Dean of the School of Social Work. She has a long list of experiences working with at-risk youth and families in her home state of Florida. And during her time at Rutgers, she founded and directed the Center on Violence Against Women and Children and received a grant from the National Institute of Justice to create the Violence Against Women Research Consortium, which provides a platform for interdisciplinary researchers and experts to collaborate on projects aiming to fill the gaps in our current knowledge about violence against women. Dr. Postmus brings to UMB a passion for teaching and student success, as well as a deep commitment to research and community engagement. So joining us today to share more about her experiences, her plans, and what it's been like transitioning into a new leadership role while teleworking is Dr. Judy Postmus. Thanks for being here today.
Thanks, Jenna.
One more quick thing before we get started. This program is being recorded and will be posted on UMB's website. If you want to ask a question, please use the chat function. That's the speech bubble on the bottom of your screen or in the upper right-hand corner if you're using a cell phone. When it comes to time to take questions, listen for your name. I will unmute your mic, and all you have to do is speak up. And if you're watching on Facebook Live, use the comments section to ask your questions, and I'll try to relay some of those as well. And now I'll turn things over to our host, UMB's Interim President, Dr. Bruce Jarrell.
Thank you, Jenna, for that introduction. It's a pleasure to be here, and I want to welcome all the participants who are out there in the audience. It is my pleasure to introduce you to Dean Judy Postmus, who's now been with us not quite 1 month. Dean Postmus, have you gotten used to being called that yet?
No, not yet. I'm still working on it.
So this is a heck of a time to be coming to Baltimore, given all that's been going on. Here you come in, and what's the first thing? Most of your school is teleworking, they're telelearning, they're even doing tele-research. What's been the experience for you coming into a new position like this with all of those conditions being thrust upon you?
Yeah, it's been an interesting transition, to say the least. It's one where, fortunately, everyone has been used to meeting online like this and meeting with Zoom and WebEx. And so, I've had the opportunity to meet with some great people at the school and the university so far. It's just not the same, though. Like when you take a new position and you have an office and you walk around and you run into people into the elevators and on the hallways. I don't have that experience. And so I'm really looking forward to the day when we can all be there in the office again and have greater face-to-face interactions with them. But so far, so good. So far, I'm doing well.
Well, that's good to hear. Maybe we need a virtual water cooler and coffee pot, We haven't come up with that one yet, but maybe we should. So welcome again. It's nice to have you here, and I know you immediately immersed yourself in a curriculum for students starting in the fall, and of course, part of that's going to be virtual, and there's some new courses that you have lined up. Could you tell us about what your plans are for your students in the fall, and a little bit about the coursework that you've been planning?
Sure. So the faculty have been super busy getting ready, getting their online classes ready. So we are almost all virtual for the fall with our students. There will be some classes that will be in person. And I want to give a shout out to the faculty and to the team, the IDEA team, which are instructional developers. They've been working really hard at converting their classes to an online platform. They're using both synchronous and asynchronous methods so that they can truly engage students. Exciting new courses we're introducing, that this one will actually be offered both online and in person, depending on the student's desire, is our new course on structural oppression, which is a new required course for all incoming graduate students. This course will encourage students to understand the causes, impacts, and strategies to address all forms of structural oppression that's based on race, gender identity, sexual orientation, age, ability, national origin, class, etc. And as I mentioned, it's offered online and in person, giving students the choice. We're also launching, and already launched this, I think it was about a week and a half ago, we launched an online prerequisite course for this course called A Brief History of Oppression and Resistance. And this online course takes about 15 hours to complete. It focuses on Baltimore as a representation of other cities, communities, and groups who experience and fight oppression of themselves and others in our society. It includes narrated content and links to resources for further exploration. So there's a number of exciting courses that are being launched again this summer and in the fall. And of course, August 17, we launch our student orientation for the incoming class. So I'm looking forward to classes getting started and engaging with students virtually and hopefully someday soon in person.
Right. So there's been a lot of discussion, and I support highly, and a lot of people support the idea that at either orientation or sometime during the fall semester that we stand up a course of sorts for all of our faculty, staff, and students at UMB. What's your idea about that, and how much work is that going to be to get ready to go?
Yeah, I'm hoping, I've been talking to some key folks at the school about how can we take this 15-hour course that is long. I took it myself, and it has some great information, a ton of information, but it is geared for social workers. And so we're going to talk about what pieces of that course could be taken out and created into another 1 hour type, 1 hour, hour and a half course that could be available for other people. And so I'm working with a couple of people to start thinking about how we could do that, looking at some of the folks who do our continuing education training. So because it is more of a training type module instead of a course that we could use for other folks around the university.
Right, but it's a very important transition for us on this campus to make sure that this happens and that it happens in an effective way, because that's one of the ways we're going to fix this university relative to the structural racism that certainly exists here. Tell us, you're going to be online in the fall with this few exceptions.
Mm-hmm.
So what are you thinking about there, and what problems do you envision with going online?
I think if you had asked me this question back in the spring when they had to convert very quickly, we'd have a whole different conversation. But I think a lot of our returning students are now used to being online. I think the faculty are getting comfortable with it. There's a good support team for them to help them be creative with their online material. I think that balancing between doing asynchronous, meaning that they're doing work on their own, students are doing work on their own, versus synchronous, where they're actually meeting with a professor online at the same time. I think all of that, it will make it not necessarily the most ideal, but it will make it a really good educational opportunity for our students. I'm hoping that once COVID ends, that this might be something we continue to do for a smaller subsection of our student population who really enjoy online learning as we get back to regular classroom teaching.
And you're also planning to have some student client services in the community in the fall, and what are you thinking about that?
Yeah, so our experiential learning, we have all of our students are required to do what we call field placements, or to be out in the field and work in nonprofit organizations or other organizations out there. We're rapidly placing most of the students have been placed already. We're working closely. Our field department, headed up by Dr. Sam Little, is working closely to make sure that the agencies provide a safe place for students to either do remote practice experience like remote counseling, or to be in-person counseling and making sure that they're safe being able to do so. As you know, social work as a profession is a frontline type profession. So sometimes we can't do virtual. We just need to be there with the clients. And so we're paying attention to which agencies we have the services in place and who are ready and willing to take our students. So our students will have those experiences as well as the didactic or the classroom teaching.
Right, so Dr. Little has been very involved with us in terms of our recovery task force, and has co-led with Dr. Donna Parker the whole recovery plan for experiential learning, which is a critical part. I mean, when you look at the essence of UMB, it is about experiential learning, isn't it? It's about becoming a professional, and there's only one way you get that. And that's in interacting with clients and patients and others. So I appreciate all of that work. I want to remind the participants that we do have time for questions. shortly. So please get your questions in, and we'll get Dean Postmus to address some of those as we get through this. One of the nice programs that I think there's a lot of nice programs in social work. And by the way, for those of you listening, the School of Social Work, after the School of Medicine, is the second best research funded school in the university. Woohoo, right? I think that's marvelous. And it's all kind of research that most of us in the biomedical world don't understand really well. You're much better at community and social sciences research than we are. You have one really neat program in Promise Heights with Bronwyn Maiden, who's led that. What are kind of your plans for that program? Where do you see that going?
So I think Bronwyn is an excellent leader, and her team, they're really well poised to the work that they're doing in Promise Heights with the 5 schools that they're engaged with. She and I have been talking along with our Associate Dean of Research, Paul Sacco, to talk about how we can better embed research and provide support, community-based, participatory type research with our researchers, along with the work that's being done at Promise Heights. And I'm looking forward to opportunities where we can provide that level of support to Bronwyn and her team. So we could really demonstrate the work that they're doing is making a difference in the lives of children and their families, and in the educational systems, working with our faculty to help disseminate that information in ways that is meaningful and helpful for the community. And so I'm really excited about the potential work with Promise Heights, as well as with work that's being done by SWACOS, which is our community organizing group, as well as some of the work that's being done. They call themselves the Area Code 21217, which I'm learning those area codes. Met with some community leaders this past Friday. Very excited about possibilities of how our school can be engaged with providing support and resting on what we do best, which is our research and evaluation and teaching, and try to bring that expertise and engage the community in that way.
Yeah, and that's a really big award. That was a $30 million Department of Education award. That was a tough one to land. A lot of people worked to get that one here. So I'm certainly looking forward to the many positive results that will be coming out of here. Now, you brought a pretty broad experience of research with you from Rutgers, particularly about abuse of women, financial abuse, financial empowerment, many other kinds of incorrect programs relative to women. Could you talk a little bit about your interests there and where you see that kind of research going and who's funding that?
So I could spend hours talking about this because I love talking about the work that I'm doing. So I've been working, before I got into academia, I worked in the domestic violence field as an executive director of a nonprofit organization. And I learned from the survivors that money was one of the big issues and why they struggled with leaving, right? That it was that they felt trapped in the relationship because they either didn't have access to the money, or they didn't have any money, or they didn't know how to manage the money. And so at some point I was introduced to some work that was being done by the Allstate Foundation. And they had created, along with some advocates, a financial literacy curriculum. And so I got involved with them on evaluating that program. We ended up, started with a pilot study and then did a randomized control study across the country in Puerto Rico, where we looked at what does it take to help survivors become financially empowered. One of the things we focused on was this, what we call the invisible form of abuse. Most people, when they think of abuse, they think of physical violence, they think of maybe sexual violence, because physical violence is easy to identify, and that's what our laws tend to focus on. But financial abuse is an area that seems to be a little bit more invisible and not as readily available to see. So part of my work has been studying financial abuse and then also looking at how to empower survivors. And we've learned that they need access to money and money resources, but they also need knowledge on how to manage their money. They need the skills or the self-sufficiency skills to be able to manage the money and their lives, as well as to be confident or have the economic self-efficacy to feel like they can do this, to manage their own money and be independent. And so some of the research has supported that. And that work is being done It's not as widespread or common as some of the other forms of research is being done around domestic violence. And so I've been working with a number of researchers across the country and globe who are doing this. Many other countries are looking at this topic as well, and looking for ways to how do we even recognize financial abuse, how do we screen for, and then what do we do for survivors who are experiencing such abuse.
Right, and I think many of the people, the participants in the audience, know that we have a similar kind of program in the SAFE Center, the human trafficking program, led by Susan Esserman, and financial empowerment is a key part of that recovery. When you're a victim, that's the way you get out from being a victim. So that's a really important thing, and something I wouldn't have immediately thought of in terms of dealing with these kinds of individuals. So that's a great thing to hear about. You also helped found a center on violence for women and children, and then there was a consortium that you put together for that. So tell us a little bit about that effort and what the consortium is doing.
So when I started at Rutgers back in 2006, I had the opportunity to start a Center on Violence Against Women and Children, which again rested on what do we do well as an academy, and so the focus of the center was to address all forms of violence against women and children, from physical, sexual, emotional, financial, as well as trafficking, teen dating violence, stalking, as well as address power imbalances that permit them. And then we focused on what the academy does best, research and education, as well as community engagement. So we connected the center with broad stakeholders from the academic, nonprofit, government, and corporate worlds to talk about how to have these conversations about different forms of abuse, how to address the problem, whether it's in the corporations or whether it's in government entities. And the center was very successful in raising millions of dollars to conduct small projects, small evaluation projects with community-based organizations, all the way to large randomized controlled trials. We offered the first certificate to our graduate students on violence against women and children, with hundreds getting the certificate and thousands taking our courses. And we partnered with community groups to basically work with them to help them inform our research and what we do, and then be able to translate the research that we end up doing back to the community groups to help them inform their prevention and intervention strategies. And we had any number of projects, including from the financial empowerment is a project that I'm involved in, to campus climate on sexual violence, to trafficking, to overlap with domestic violence and child abuse, to teen dating violence. We had any number of projects happening at one time. So the consortium came around from funding. Because of the success of the center, the National Institute of Justice had a call for, they were looking for a partner in an academic center to create a consortium that focused on domestic violence, sexual violence, trafficking, teen dating violence, and stalking, to gather researchers from around the country to work with the National Institute of Justice, or NIJ. And so that project, we're about 2/3 of the way through with that particular project, where we've had the opportunity to kind of do some very quick turnaround of research projects, not long term, but short, a year and a half type projects, and we're able to fund them and then be able to spend some time talking about disseminating that information in ways that make sense for our community partners, so that they could interpret and use the data that was being created.
Yeah, it's a different funding agency, so we have a little bit of funding from the Department of Justice, a fairly sizable award in the School of Law. You've now got this award, and maybe we can get on a roll with justice. That would be a kind of a nice thing to do. But we'll see where that goes. So I know we've got a number of questions, and I certainly want to give people a time to ask their own questions of Dean Postmus. So Jenna, you want to tee one of those up?
Yeah, sure. So our first question comes from Leslie Baker. She's a part-time student for a School of Social Work, and she's also an SUDIF fellow. Her question was, I realize that the dean is not the head of field placement. However, some of us don't have our practicums lined up just yet for the fall. What are some words of encouragement that you can offer?
So Leslie, I would say hang in there. They are diligently working. I talk to Dr. Little frequently about where are we with the numbers, how many students have been placed. I'm fully aware that we're not at 100% yet. Some of the challenges, I think, have to do with where agencies are and the capacity of them being able to work with students because of COVID. It's not, usually this is not a problem, but it's because of COVID that we've been slowed down. We're looking at alternatives to how can we enhance the field experience as much as possible, whether using simulations or other type of experiences. So I would say hang in there. We're fully aware that you haven't been placed, that some haven't been placed yet, and we will make every effort to make sure that you do have that experience, because it is the hallmark of the profession. You can't get the degree without it, so we know how important it is.
And I think I would add to the response that we have a group of people who have been looking at this very closely. And from a university point of view, we obviously want to balance your safety and the safety of your client as well, with the ability of you to accomplish all the requirements for graduation. So there's a push-pull there, but both of them are very important to me and others who are in this position. And so I think I would say hang in there as well. We want to do everything we can do as long as it's safe to do. So Jenna, you got another question?
Yeah, our next question comes from Bonnie Bissonette, who's from the Center for Global Education Initiative. So Bonnie, you're unmuted. Go ahead.
Thank you. Welcome to UMB, Dean Postmus. It's really nice to have you with us.
Thanks, Bonnie.
Yeah, I look forward to getting a chance to have a conversation with you. I'm the Director of Education Abroad and International Safety. So we're in a big time of creating new opportunities for our students and for global engagement. So it's a highly creative time for us. And I just wanted to ask you what your experience has been with global education, and if you had any ideas for the School of Social Work. And then just to say up front that our center stands to serve. We work a lot with Caroline Long and the rest of the folks there that are engaged in global activities, and look forward to continuing. So again, welcome, and I look forward to hearing what your experiences have been.
Thanks, Bonnie. I am very excited to have the opportunity to meet you. I think that part of my heart is in global work. So I did some work with having some student involvement in an Israel study abroad. And I know that one of our faculty, Corey, I struggle with your last name, Corey. If you're listening, I'm so sorry. But Corey's been doing a lot of work with Israel and other universities there to help give students experience. Most of my experience since then has been focused on research. And so I've done some collaborative research work in Taiwan with a couple of researchers there. I've been connected to researchers in Macau and in Hong Kong, as well as Israel and Turkey. And I also did some work in Liberia before they had the Ebola crisis a number of years ago, where we were looking at sexual violence of girls in the couple of universities there, as well as in the primary schools and secondary schools. So and every time that I've done this work, I've always tried to bring students with me or fund students to come with me to have as a learning opportunity for them. And it's certainly something that I'm hoping that I will continue doing here at the school in Maryland. I know that there are some efforts that the school has done, and I'm hoping to expand some of it. I'm very interested, not so much in what they call the educational tourism, but more in the how can we support individuals and organizations and communities, like we're supporting them in Baltimore, of how can we support them in other countries as well? What can we learn from them? How can we partner with them? And so I know that there's a number of faculty who are doing work internationally. I know, for example, Catherine Collins has been doing some work. And I'm looking forward to joining with you and your center and see what happens when we're allowed to do international travel again. So thank you.
Whenever that is, who knows these days. Jenna, do you have another question for us, please?
Yes. So this next question comes from Angela Millette, who's a clinical instructor at the School of Social Work. So you are unmuted. Go ahead and ask, Angela.
Hello, Dean Postmus. How are you?
I'm good, Angela.
Good. I'm so glad to meet you, at least on video, and welcome. So I have, wonderful opportunity as an adjunct to have sometimes a different relationship with the students, and they'll ask different questions sometimes. I think one of the concerns, especially the past 2 semesters surrounding field work, has been those students who themselves are immunosuppressed, much less they may be taking care of family members who are immunosuppressed. And what are the options for them with field work?
Angela, that's a really good question, and I think this goes back to the question that Leslie raised earlier around field. There's so many moving parts because of COVID. There's the part about, can agencies take students? What kind of services are they providing? Are they keeping students safe? And then what about our students who are immunocompromised and can't necessarily be interacting face-to-face with folks? So all of those opportunities, the field department is looking at matching students with those needs in field placements that might be doing remote counseling. So there are some agencies, and as you know, a lot of the telework has gone, and with medicine as well as social work, that we've been using more of the remote technology. And so the idea would be to try to understand the students' needs and matching it with the field agency's needs. Now, again, that's a daunting challenge in a normal year, is to try to make this work. Field is the department is very much an underappreciated and very taxed department because of all the nuances that are involved with matching field placements with students. And COVID has made it even 10 times worse, right? So, but the field has taken on the challenge, and my hope is that a student won't suffer and won't be denied a field placement because of their own personal history or background or concerns that they have, that we can find something that will make it work for them.
And just speaking as a physician, obviously there are plenty of people here on this campus who, if consulted with, and of course you would have to want to do that, we could certainly work with you to figure out things that would be safe. And you have your own physician as well. So lots of resources available if that's needed. Okay, Jenna, how are we doing?
Good. So our next question is going to come from Jeff Martin from the School of Nursing. So Jeff, you are unmuted. Go ahead and ask.
Good afternoon. Can you hear me okay?
Yes.
Hi, thank you very much, Janet, and welcome to UMB, Dr. Postmus.
Thanks, Jeff.
I'm with the I'm an analyst with the School of Nursing, and we've had a lot of good cooperation and partnership with the School of Social Work over the years, and particularly Wellmobile. Like, call out to Randa Deacon for helping the Wellmobile. But also simulation labs work. There've been several good programs. I was just wondering if you had some ideas, from your experience on how better to, or how more or better to partner with the School of Nursing.
Yeah, I'm still learning. So I'm glad to hear that there's a lot of collaboration between social work and nursing. It doesn't surprise me because as professional groups, we do a lot together. We have very similar work that we do, especially in some of the hospitals and dealing with patients and their families. I think that there's possibility to look at different collaborations. So, for example, I'll go with my strength in my own research, looking at the certified nurses who are doing work when they do rape kit exams. That there might be some joint work between social workers and that type of program, if it is available through the School of Nursing, or even how do you educate nurses and social work students around when they're confronted with somebody who's experienced rape or violence. So there's some ideas there, and I'm open. I know our faculty is open to collaboration across campus, and nursing is definitely one of those places that we'll be turning to frequently.
Judy, I seem to remember in one of our discussions that you had some experience around simulation and social work. Does that ring a bell? And could you just tell us all a little bit about what that's about? So
the simulation and social work, so historically with some of the educational experiences, we used to have, for lack of a better word, a room with a one-way or two-way mirror that you could practice social work skills while somebody is watching you, whether it was with an actual client or with somebody who's role modeling or role playing or the role of a client. And then there would be critique and information, and that was one of the ways that social workers used in education to help prepare social workers. Now, in recent years, that style of teaching has not been around as much. It was early on, probably more in the 80s and 90s, and some schools still have it. So it's an area that I think, because we've relied so much on our field experiences as being, instead of having a simulation or a role modeling, it's really having the real life examples right away, where they often will do case recordings and have supervisors just maybe sit in on their sessions and do detailed notes about what they do with their clients. And so we've pivoted as an educational system to less simulation and more in with real clients. But that doesn't say that with COVID that we might need to shift and do look at simulation again to help expand and enhance the services that students get and the experience that services has. And I just saw that I just learned that SWACOS has that type of setup to do that testing and with the two-way mirror. So it might be something that we could explore a little further in a safe way with our clients or with our students.
Right, thank you. Jenna?
Yes, so our next question comes from Tyrone Roper, who's our director of the Community Engagement Center. So Tyrone, go ahead and ask.
Wonderful. Welcome, Dean Postmus. How are you?
I'm good, Tyrone. How are you?
I'm well. I won't trouble you. I have about 20 questions, so I'll run off real quick here. So really, I don't have questions. I just wanted to say welcome on board. I'd love to be able to have you over to the Community Engagement Center to see what the great work my team specifically is working on. We really do have a very broad range of things that we're working on to tether back to the support of the community and to just to be able to glean from you on what direction, how the direction looks that we're building out. Any insight that you would have, I think would be super helpful. I'd love to be able to get on your calendar and invite you over to the Community Engagement Center to see what we're doing.
Absolutely. So, for those that are interested in meeting with me, Christina Fenwick is my assistant who is making appointments for me. You can reach her by just emailing Dean, D-E-A-N, at ssw.umaryland.edu and say, Dr. Judy or Judy said I can meet with her. So I would love to, because you're on my list, Tyrone. I wanted to make sure I got out to the Community Engagement Center at some point because I've heard nothing but positives about the center. In fact, I understand that one of our graduates works there. Ashley, I think is her name. So I'm looking forward to the opportunity to learn about the work that you're doing and try to determine how best we can work together and support the work that you are doing. My heart is really in the community. Even though Baltimore is a new community for me, I've been working in communities across the country my whole professional career. I started my first professional job was working in Miami and Liberty City right after the riots in the early 80s. And I just see the value and strengths and resilience that are in our communities. And my hope is how can we use the school and the university's resources and information to support communities to do what they want to do and to accomplish the goals that they want to accomplish. So I'm looking forward to meeting you someday, Tyrone.
Hi, Tyrone, and I wanted to make sure I said hi to you. I don't know whether Ashley's on the call, but you form a very powerful team over there. So thank you for all that you do.
Thank you both.
Thank you. Jenna?
Yes, so our next question comes from Judith Shagrin. She's an alum, a mom of an alum, and right now taking a break from being an adjunct. So Judith, go right ahead.
Hello. We met in one of the interviews with Judy. So welcome to Baltimore. And I'm sure you'll come to love our quirky little city. So I just wanted to mention, I spent a really satisfying career in public child welfare. And I know how important a professional social work workforce is. Most caseworkers in Maryland are not social workers. And I think we would have a far higher quality system if they were. Yeah. So with everything going on, and let's face it, public child welfare, global social work, so much more intriguing. I just wonder, I don't want the school to lose sight of the importance of preparing students and wonder if you have any thoughts about how that might happen. But mostly, I don't want you to lose sight of it.
Yep. No, Judith, trust me, I won't. And thank you for asking the question and for being here. And I do remember meeting you way back. It seems like such a long time ago in February when I was on campus. So one of the good things about the School of Social Work is that we're really big. And so while we might say, well, let's look at global, well, we have the opportunity to do it all, right? Because we have enough faculty and staff, we're a large enough organization, we're really good at getting grants, as Dr. Jarrell mentioned earlier. And so I think that there's opportunities that not one area is going to go under supported. So certainly child welfare is an area that is very well connected in social work. We have our Title IV program that supports education of public child welfare workers to get their masters. I'm hoping and to have the opportunity to meet the head of the child welfare organizations in the state to see how we can best work together to help train and educate the workforce. We did some projects when I was at Rutgers where we created specific educational programs for child welfare workers to get their masters, including an intensive weekend format. It was funded by the state through Title IV funding and through federal resources. The program had to go away, but the intensive weekend format is still there. That basically encourages folks who are working in a social work environment like child welfare, who don't have a master's of social work, but they have all this great experience, to do a master's in a little different way where they can use their current work as their field placement, as well as then to have classes that meet online and in person on the weekend so that they can actually attend because they're in work every day during the week. So I'm not losing sight of public child welfare or other areas. Our faculty have a wealth of areas that they cover and that they're engaged with, and our education, as you know, as an adjunct, covers a wide span of opportunities as well for our students. But thank you for the reminder, and thanks for being here again.
Thank you. So Judy, you just had a new chief diversity officer join your school. Could you tell us a little bit about her and what's planned?
Monday, Nejima Donnelly starts, or O'Donnell. I'm still working on her last name, but I think it's Donner. She starts on Monday. We're really excited for her to start. She is going to be an assistant dean for diversity, equity, and inclusion. She's going to be working when we actually are back in the offices working. She'll be working in the dean's suite, working closely with me and a number of other key leaders around the school. Nejima comes from the University of Maryland, College Park, where she was working in the diversity office. But even more interesting and important is that she's a graduate of our MSW program and worked as a clinical instructor for a number of years before going to the University of Maryland, College Park. So she's the challenge for her and for me is to really address the diversity challenges within the school and outside the school, and how we can support efforts that are happening in the community, as well as paying attention to what we're doing in-house, looking at our curriculum, looking at our policies and procedures, looking at everything from the vendors we use for catering, for example. I think we're going to be paying attention to everything that we do and how can we ensure that we are being inclusive and hearing diverse voices, as well as including different groups to participate. And so I'm really excited. Nejima's got a big task on her hands. I'm fairly confident she's up to the challenge because of my interactions with her thus far. She's a wonderful person who I think is super committed to Baltimore, super committed to the school, and really wants to help make a difference. And I'm excited that she's starting on Monday.
Terrific. Jenna, we have, by the way, keep your questions coming in. Jenna, do we have other questions?
Yes, so our next question comes from Donald Tobin, the Dean of the School of Law. So you are unmuted, go right ahead.
So welcome, Judy. Can you hear me?
Yes, we can hear.
How are you, Donald?
I'm doing great, and welcome. We're so excited for you to be here with us, and thrilled to be able to have this conversation, even if virtually. So I wanted to hear your thoughts about the importance of social work in our current world environment and the way in which you think there may be a special place. When I think about COVID, but I also think about the social justice problems in our nation, And I think about the mental health problems people are experiences. I see just all of these problems in our nation and see a role for social workers in so many of them. So I just wanted to hear your thoughts about, does that change the way we think about social workers? Does that change the way we train our students? Does that change the way we interact with the community? What are your thoughts about the social worker's place in the world, so to speak?
So thanks, Donald, for that wonderful question. I think that social work as a profession is often misunderstood. I think people think of social workers in the most negative sense, and often think of people who come in the middle of the night and take children out of homes that are abusive. That is not what social work is all about. We are, as you mentioned, we're on the forefront of dealing with society's problems and social problems. We're on the forefront of trying to prevent and intervene with any problem, whether it's an injustice based on a categorization of race or identity or age and so forth, or we're on the forefront of dealing with problems like mental health issues, substance abuse, homelessness, domestic violence, sexual assault. So there's any number of things that social workers take on. And we're a pretty broad organization and pretty broad profession. But one of the things that makes us unique as we think about social work as a profession is that we not only think about the person that's sitting in front of us, but we think about the larger picture and what are the forces, the environmental forces that might be playing into this role. So for example, we think about COVID and we think about mental health challenges as one example of saying, well, how does COVID and mental health go together? Well, they do go together, whether it's the employee and a staff member or a faculty member who's working alone and they're now thrust into everything remote and they've lost their social connections. And so they might be dealing with mental health issues of depression or anxiety. There might be people who are anxious about even going out into the field and interacting with others because of their own situation and their own fear of getting sick. And so there's any number of, and COVID certainly has affected families from a financial perspective, right? And so social workers are often on the front lines of dealing with all these social problems. While we might not be curing COVID, we are certainly working with everyone who's experiencing COVID and working with and supporting the families, the institutions, and others who are working side by side to address COVID. And this is just one example. I often think that social work, I think about, especially in hospital settings where, when a doctor runs into a problem with an individual, not because of the diagnosis, but because of the entrenched family or something else, dynamics are going on, or they don't know where this person is going to live, they often say, well, where's the social worker to solve this problem? That we take on the problems that others may not want to take on. And so we have the opportunity to work with any number of professions, whether law, medicine, pharmacy included, nursing, whether it's, with criminal justice systems, dealing with communities, dealing with the society challenges. Social workers are there, and I think social workers can be found in the halls of Congress as well. In fact, one of our illustrious alumni, Barbara McCluskey, is also a social worker, and a number of social workers have played a role in policy around the country. So I think the lessons learned from COVID, I think, is to pay attention to how are we delivering services, how are we reaching the problems that and the families and individuals and communities that are experiencing those problems. How are we reaching them during this time of COVID? What have we learned that perhaps that even using some of the technology that we might not have used before COVID, we're now using during COVID? Can we keep some of it when we are done with COVID or have managed COVID, however we're going to do that? So I think that there's any number of ways for social workers to continue to think about it. And I think our profession, even our education and how we deliver the education, I'm all in favor of, well, what can we learn from what we're going through now and how can we apply it to a better future? And so I'm hoping that we will continue to do that as a profession and as a school.
Great answer. Thank you. Jenna, do we have another one?
We do. Our next question comes from Nadine Finnegan-Carr from the School of Social Work. So you are unmuted. Go ahead and ask, Nadine.
Thank you. Hi, Judy. How are you?
I'm good, Nadine. Are you going to ask me why I haven't been there on Saturday mornings? Because
No, I haven't. I wasn't going to ask you that. I won't throw that guilt on you. You're kind of busy right now.
For those who don't know, Nadine and I are part of a group that's it's called Easton's Nook, and they're based in Newark, New Jersey. It's a writing retreat center, and they've been holding remote writing retreats every Saturday morning. And Nadine and I have been on the same group for a while until I started this job, and now the writing kind of taken a spot. So,
it's okay. But I have a different question for you.
Okay.
So, Baltimore is the secret faculty member of the School of Social Work. If you haven't been told, Baltimore as a city, the good and the bad of it, the politics, the culture, the neighborhoods, the rich history, the racism, all of it. How are you preparing to learn about Baltimore itself and its impact on our work?
That is a great question, because it's a little hard in COVID to get out and about, right? I was thinking, I was in Baltimore for most of the month, and I was trying to figure out, okay, even the simple sightseeing things, right? Even though I know that's not the heart of Baltimore, but just to get a sense of the feel, everything has become more complicated. So what I'm doing is I'm meeting with as many people as possible, and I'm saying if we can meet face to face in a safe way for everybody, then we can set that up. Otherwise, doing a lot of remote meetings. So, for example, on this past Friday, I met with community groups from who are doing amazing work in the 21217 area code. I met with folks and staff who are doing amazing work at Promise Heights as they were doing some food distribution. I'm meeting with Wendy from Swakos. Again, this one is remotely, to learn about the work that they're doing. And I'm hoping that, as restrictions ease up a bit, that I'm able to get out and about and to really learn. And I feel like these first few months of being in this job is really just, let me meet with as many people as possible and be a sponge and take in and have a sense so I can get an understanding, because Baltimore is new to me. And I want to, I've not been told that it's a secret faculty member, but I think that's an apt description. And I will, maybe we need to make it not so secret anymore and make them a full-fledged, visible faculty member in our school, that we are paying attention and thinking about Baltimore and everything about her, and how we can support her as a school. So it's a good question. If you have ideas, send them on. We'll get them scheduled as much as we can, and I will keep learning and listening and trying to get a sense of what, how best the school can be positioned to meet the needs.
Great. Hi, Nadine. Thanks for the question. Judy, great answer. But we've got a lot to show you in Baltimore. There is plenty to see. Jenna, you got another one?
Yes, so this next question comes from an alumni from the School of Social Work, so go ahead and ask.
Hi, welcome, Dr. Postmus. I'm sorry if I'm mispronouncing that. So Jenna's right, I'm an alumni from the School of Social Work, and so the School of Social Work has a long history of maintaining white supremacy and silencing voices from people of color, particularly women of color. And this goes for staff, faculty, and students, which also trickles into the relationships with the community members. At the same time, the institution, which has historically and actively been participating in oppressing our own community members, is also educating hundreds of social workers each year to go into the communities and perpetuate these societal oppressions. Anti-racist organizing has been happening at the school for decades and has been continuously met with administrative resistance. So what sorts of commitments are you willing to make to repair this decades-long harm and also truly make the institution anti-racist?
Well, thank you for asking the question. I don't think you shared your name, but that's okay. So I'm fully aware of the challenges in the history of the school. I've read a number of documents and have talked to a number of people. And so my approach to this, first, is my commitment, right? My commitment to social work embracing who we really are, which is to address oppression and not to perpetrate it. And second, to really ensure that voices are being heard. And so I'm, whether it's having more participatory style conversations with folks, having less micromanagement from the dean's office, paying attention and listening to what people have to say, incorporating them into our ideas and plans. I think this goes back to the answer I gave to Nadine, which is really thinking of accepting as much information as I can and listening as much as I can, and then how can we translate that back into making sure that we are addressing all of these concerns, because I'm with you. We cannot be practicing it in the school. We cannot be oppressive in the school. We cannot have people feel like their voices are not being heard, whether faculty, staff, student, regardless of position, regardless of rank, regardless of whatever they have. And this lesson I learned from my father very early on. It doesn't matter who you are and what position you have, whether you're the president, the dean, a student, an alumni, that everybody has a voice and everybody has strengths and gifts and abilities. And you never know when somebody might have an idea and have a concern that can really help shape the way things are. And so if you don't listen to people, you don't have those opportunities. And so we have got to be committed as a school to look at everything that we do to make sure we're not oppressive within, to make sure that we're educating our students to not be oppressive when they go out, to be aware. I think this is where these courses that are being introduced, the prerequisite course, looking at structural oppression, the course that we're offering that is mandating for all students to take, the hiring of a diversity and equity and inclusion officer to really work closely with me, my insistence that she be placed within the dean suite and that she will always have my ear and always meet with me and always be able to make sure that if something happens, if I'm personally doing something that is oppressive or that people feel like they were squashed, that she will check me and encourage me to, hey, think differently. I think that's super important. And the person, Nejima, that I hired, I think that one of the reasons I hired her was even during the interviewing process that she challenged me in the interview. And I said that was what I needed. I needed somebody who didn't look at me as the dean and said, okay, I can't talk to you, I can't confront you, I can't challenge you. I want to be challenged. I want to be open to hearing. Does that mean that everybody gets everything that they want? No, of course not, because there's limited resources and limited opportunities. But I will do my best to do what we can and work together. And so I hope that answers your question. I hope that as an alumni that you still look back on our school in a favorable light. And if you don't, to have the opportunity to come be part of the alumni group and work with me. I'm going to be working with the alumni to really think about what can we do as alumni and what can we do for the current students to make sure that they're better prepared and have stronger prepared to address oppression in our community. And how can we really meet those challenges together? So thank you for the question. I really do appreciate it. And I hope the answer was one that, and feel free to come schedule time to meet with me.
Thank you, Judy. We have time for one more question. Jenna, I believe you have one more, don't you?
Yes. So this one is actually from our Facebook Live. It says, Dr. Postmus, do you have a planned strategy to make the school a presence in the rest of Maryland outside of the Baltimore region, or any ideas to make that possible?
Yes. I'm working on a strategy. I know that our school has classes that we offer on the University of Shady Grove campus. And I'm hoping to look at that campus as a way to perhaps expand some of our reach. I think that the question becomes one of reach for other educational opportunities in the state of Maryland, whether we do it physically by having classes in other university centers or whether we do it remotely through the use of technology. But I'm definitely, Shady Grove is on my list of places to perhaps look at expansion, because I know that's, and I'm still learning about Maryland, but I know that's a further place, a southern place in the state. But I'm hoping that, and certainly working with state agencies, whether it's child welfare agencies or those who work with families getting TANF, or even the criminal justice system, and trying to help around the state. And plus, as someone mentioned to me, thank you so much, our placements are around the state. So we're getting students already from around the state. We're placing students around the state. Again, as we think about how we offer our educational plan, the strategy would be what lessons have we learned from COVID? How can we take those lessons learned because we went remote? How can we take those lessons learned and apply it so that we can still continue to reach out to students in other parts of the state, and continue to have field placements in other parts of the state, and to not just be because we are with the University System of Maryland, not just Baltimore. So thank you for that question.
And we also have a tight association with the undergraduate bachelor's in social work at UMBC, of course, which I know you know about.
I'm so sorry I did not mention. Yes, UMBC is another. I'm excited to work with them. They have their longtime director has just retired, and a person by the name of Shelley. And I have to tell you, I'm really bad with names, but I know what people do. So I'm working on this. But Shelley is stepping in as director. I'm excited to be working with her and with the provost and the president that's there to see how we can strengthen that relationship as well.
So, okay, well, this has been a delightful hour. Dean Postmus, it is wonderful to have you here in the saddle, ready to go. Lots to do. I want to thank all of the participants, not only for listening, but also for your questions. We learn a lot on these. I learn a lot, and we've got a lot of work to do, as I think has been pointed out. So thank you again for being here. Judy, it's been a great pleasure. We'll see you all later.
Thanks, Bruce.
Bye.
Thanks, Jenna.